Hi, my name is Jeffrey Alfaro, and I'm an undergrad in the College of Arts and Sciences studying neuroscience. This is my poster titled Using Non-Invasive Brain Stimulation in the Treatment of Chronic Post-Stroke Aphasia. This is a preliminary analysis of TMS, a type of brain stimulation, as a supplement to constraint-induced language therapy. This summer, I was given the opportunity to work with aphasia patients. Aphasia is an acquired loss of language abilities that affects nearly 30% of individuals with strokes and nearly a million Americans. It's important to note that every patient responds differently to treatment and that every aphasia is very different. The aim of the study was to demonstrate that transcranial magnetic stimulation paired with constraint-induced language therapy improved language performance more than sham TMS and CILT. TMS was provided at 1 hertz at 90% motor threshold delivered to the right IFG. The reason for this is because the right hemisphere actually inhibits activity in the left hemisphere where activity in like language tasks is controlled. Therefore, when stimulation is provided to the right IFG, that part is actually inhibited, which prevents cross-hemisphere inhibition. Our criteria to see whether patients increased in their performance was a greater than 5 increase in the Western Aphasia Battery aphasia quotient. The Western Aphasia Battery is a test that is provided, a language test that is provided to patients to see how severe their aphasia is and what they classify as. We then looked not only at baseline, but at 3-month and 6-month post-treatment. And WAB-AQ scores were the primary outcome measure of our study. Notably, MRIs were also provided at visits 5 and at the 6-month follow-up. Here you can also see demographic and study criteria. Here we list the various factors that would either include or exclude you from the study. The most important are a WAB-AQ score between 85 and 20 at baseline, and also being a human subject with single left hemisphere cerebral infarcts. Notably, in the exclusion, multiple infarcts, history of substance abuse, also seizures, being pregnant, and children and prisoners were excluded from the study. You can also see a table of the various factors and aspects of different patients that were enrolled in the study and completed the study. As far as the results go, all individuals did score higher at 3 months post-treatment than their mean baseline scores. In the sham TMS group, only one individual had an increase that was greater than 5, which indicates that this was a variable response to CILT alone. Notably, this one patient's scores may have been affected by their baseline aphasia severity, which was not very severe, and that the participant missed the 3-month post-treatment testing. Additionally, we see that in the active TMS stimulation plus CILT group, 3 out of the 6 patients actually showed greater than 5-point increases. And we see that patients with less severe aphasia may be less likely to respond because of a ceiling effect where because they already scored pretty high, there's less room for improvement. Severity at baseline may be a factor determining response to TMS. Ultimately, we see that this data supports the efficacy of TMS as a supplemental tool to CILT in the treatment of chronic post-stroke aphasia. There's a table here where you can see individual data from each patient and how their scores improved or declined in different sections, since the WAB has various sections, and because every aphasia is different, patients could have increases in some sections and not others. Here you can also see my references, and I would like to acknowledge that this work was supported by a UPENN CURF grant and Dr. Roy H. Hamilton, who gave me this opportunity. Additionally, much of my work was in collaboration with Denise Harvey and Leslie Venichek, individuals who are in the Laboratory for Cognition and Neural Stimulation here at the University of Pennsylvania. Additionally, if you have any questions or would like to discuss my research, you can contact me at jalfaro@sas.upenn.edu, which you can see on the bottom right. And thank you for viewing my presentation.